According to worldmetrics.org, medical billing errors account for an estimated $68 billion in unnecessary healthcare costs annually. It goes without saying, but understanding the ins and outs of medical coding and billing are super important. Being able to accurately document services and procedures rendered during a visit can be the difference between receiving revenue on time or not. However, some aspects of medical billing and coding can be a bit more complicated than others. One of them being National Correct Coding Initiative Edits, or NCCI. Let's go over what NCCI edits are and why they are important. The NCCI is a program under the Centers for Medicare and Medicaid Services, or CMS, which houses specific coding policies and edits. The CMS owns this program, deciding any decisions regarding the rules and regulations within. They base the coding policies off of the content in the American Medical Association's Current Procedural Terminology, or CPT manual, as well as national and other local policies and edits. Other sources of information taken into consideration by the CMS include coding guidelines developed by national societies, analysis of standard medical and surgical practices, review of current coding practices. Originally formed in January of 1996, the purpose of the NCCI is to prevent improper coding, more specifically to reduce instances of duplicate codes and ensure services rendered are medically appropriate. It promotes national correct coding of Medicare Part B claims. Medicare Part B tends to take care of medically necessary services and preventative services. Some examples might include outpatient office visits or same-day surgery. It was in 2010 that the Affordable Care Act required CMS to notify states that Medicaid is compatible with all 5 Medicare NCCI methodologies. Today, NCCI edits are essential when processing both Medicare and Medicaid claims. NCCI edits are often used for identifying incorrect code combinations and incorrect units of services recorded in a day. There are 2 separate categories that make up these edits: procedure to procedure, or PTP edits, and medically unlikely edits, or MUEs. PTP edits help to prevent providers from reporting incorrect payment of services together. The NCCI includes one table of edits for physicians or practitioners. They include another table of edits for outpatient hospital services. Column 1 for HCPCS and Column 2 for CPT. For reference, HCPCS stands for Healthcare Common Procedure Coding System and CPT stands for Current Procedural Terminology. A great example is when a patient receives a surgery. The closure of the wound for that surgery is inherently included in the billing. You don't need to also bill separately for closing the wound on top of billing for the surgery. An MUE is a unit of service edit for HCPCS and CPT codes. More specifically, for the maximum number of units you would bill for a service rendered by a single provider for a beneficiary on the same day. These MUEs help to reduce errors when it comes to clerical entries and any incorrect coding based on the following criteria: anatomic considerations, HCPCS or CPT code descriptions, CPT coding instructions, established CMS policies, nature of a service or procedure, nature of an analyte, nature of the equipment, prescribing information, claims data. Understanding how this edit works can help your practice reduce your paid claims error rate for Medicare claims. If you'd like to learn more about NCCI edits, reach out to eTactics, and you already made it this far into the video, so you might as well like it, share it, and comment below.